So this was a topic that we had a few requests on. So what we're trying to do with this is to really provide some contact tracing tips and some kind of tips for managing cases, on teams. It's not really intended as kind of a talk on prevention efforts. This is more looking at kind of once you identify cases on a team, what are kind of the next steps to minimize impact. So there's not a lot of published data with looking at athletics in Washington State with COVID. It's not a question that is really on any of our interview forms in terms of looking at athletics or gyms or physical education or those type of things or sports. So where we're getting a lot of this information is just from some of the outbreaks that we've investigated, over the fall and earlier around fitness, gyms, and looking at all the activity that we've had with the colleges, with their athletic programs and kind of the outbreaks that they've had. So that's kind of the context.
It was all Blaine.
Where did you do the volume now?
Okay.
We can hear now. It was Blaine.
Can everyone hear me? Are we good? Lisa, can...
Yes, I can hear you.
Okay.
I muted somebody. Sorry.
Oh, okay. I just wasn't sure if I hit the wrong button or not. So we'll get started. So I've got a few slides and we're just going to kind of talk through things. If there's questions on any slide, just talk and bring those up. I'm not going to be able to see, if you raise a hand, in Teams or anything like that. So just interrupt me. That's fine. We want to make sure that we're answering all your questions. So where I'm going to start is kind of looking at kind of the close contact, definition. And what we have historically been used to is kind of the 6 feet or less in 15 minutes or more. And this is really what we look at for the workplace. It's kind of for a sedentary person. It's not really, that protective, when we're looking at higher intensity physical activity where you have a higher respiratory rate and, certainly there's more risk. When we look at other activities, where, there's a potential more risk in terms of respiratory rate or activity, like music, we've typically been very comfortable going with additional distancing recommendations or time recommendations. And so what I'm want to have you look at with this is that when we look at kind of moderate or high intensity sports, that we really need to look at, potential contacts that wouldn't be 6 feet, but really realistically up to 12 feet, and even with using a mask. We will probably want to consider, contacts where there's, potentially significant close contact. And if it's, under 15 minutes, we also want to consider that as potentially a close contact that would be quarantinable. Kind of where we've seen a lot of this really in evidence has been with fitness centers and some of the outbreaks that we've seen in those areas. We had one outbreak earlier, in 2019 that was associated with a spinning class. And in that setting, we had, people separated about 9 feet apart. But one case that we had in that setting resulted, in everyone in the front row, getting COVID, and, the row behind that, so, potentially, 15 to 18 feet past, we even had transmission occurring in that setting. Granted, that was not with wearing masks, but it just goes to show, how efficient transmission can be, when we look at, with COVID, with high respiratory rate activity. And when we look at this from the perspective of college athletics, for the most part, all of our local colleges have seen cases and transmission associated with teams, with all of the sports that they've had, where there's been some in-person practice or competition. This isn't something where, it's affected 50% of programs or, 70% of programs. It's been pretty universal. And so that's why I really want to encourage you, when we're looking at contact tracing, to not be rigid in looking at that 6 feet and 15 minutes, because if that's your measure, then you're going to have people who are potentially infectious on the team and more widespread transmission occurring. So I bring up, it's easy to see high intensity sports as being cross country, track, basketball, some of those where, you have really a good amount of, long periods of time with high intensity. But even with the sports like tennis, volleyball, football, some of those sports where you have intermittent periods of high intensity, you're still going to see those same transmission dynamics. So I just put, this picture in here. I mean, this is kind of your typical cross-country practice. When I was driving into work, probably about 2 weeks ago, well, probably not 2 weeks ago, but maybe a week ago, I was driving downtown, and there was probably a group from LC or NC running, downtown, very much like this. You're running in a pack, and none of those people had masks on. And so, the big challenge with that, even when you're looking at an outdoor activity, and you're in a situation like this, where we would typically think of this as an individual sport and lower risk, if we practice in a situation like this, where we're essentially running in a pod, anyone in a group setting like this would be considered a close contact if one of them became positive. And so I want to, just throw that out there as you're thinking about this. It's not just, how an athlete competes in one particular event, but you really have to look at kind of the practice dynamics and some of the other issues that happen. So when we kind of look at the contact tracing, we want to kind of look at it from the perspective of, the groups of people potentially exposed. And, what we look at is 2 days prior to someone's onset of symptoms, or 2 days prior to the collection date of their test, if they have no symptoms, as that period of time where they're infectious. And so, we have the potential for exposing a small number of players or athletes, or a larger number, depending on how we set things up in our practices. My background in athletics, I've been a volleyball coach for a number of years, both high school and club. So I kind of look at it from that perspective. I don't always kind of see everything from the perspective of the individual sports or, some of the outdoor sports. But this is one of the things that I think coaches and athletic directors can do a good job on, in terms of minimizing risk, within their program. What I mean by this, when we look at that first rule of thumb, and this is just, a way of looking at kind of exposure situations. It's not prescriptive, but it does cover, probably 70–80% of cases. Why I say quarantine close contacts aggressively is because, let's say I am very loose in terms of quarantining. I don't quarantine, that many contacts. They're in a volleyball practice, and you talk with the coach and you talk with the player, and no one else is identified as a close contact, and they've been practicing. From a perspective of that being reasonable, I don't think that's reasonable at all in terms of actual, likelihood of someone being a close contact. And what could happen out of that is that you could have more people impacted and the team impacted more significantly. So this is talking to coaches and athletic directors. If you have a situation where we are seeing a case on a team, we wouldn't necessarily automatically quarantine a whole team with just one case. Certainly with 2 cases on a team, we would look at quarantine of the team. But if you're a little bit more aggressive at the beginning in terms of quarantining close contacts, and I'm on that volleyball team, I have 13 players as an example. I have 1 case, I quarantine 4 or 5 other people. That puts me in a good position where I don't get my second case, who's infectious while in practice. And if that's the case, my team can move on. My team can potentially compete if that's allowed. I can pull up other players back. But if that team gets to that second case, because I was, not being that diligent early on in the contact tracing, then that whole team is out for 10 days. If I have additional athletes who are out, where they're out for 10 days, for their isolation period. But there's also that return to play guidance that school nurses had put out, where you're not returning to full practice or competition right when you get back. There's an 8-day process where you're kind of moving through slow steps before you can return to full practice. So part of being aggressive with the contact tracing initially is that you're minimizing the risk of losing a whole team to quarantine, and you're also minimizing the risk of athletes who are getting COVID and then potentially being out for not 10 days, but being out for 18 days before they can fully return to competition. So that's one of the the issues that you want to look at from that perspective. For nurses and other staff who are doing contact tracing, certainly ask about moving between pods or teams, because some programs are shuffling up pods every day or 2 days. And so you need to really look at who a player has been working with or practicing with each day that they were in training. You also want to look at it from the perspective of some of your individual sports. Certainly cross country. I provided that example earlier on, where you may think about that as not a team-based sport or a pod-based sport, but really for those examples of runners running downtown, you're not running downtown alone. You're running downtown as a group, probably for some of the safety issues and some of the other issues. And so it's really going to be important for coaches to really define who those pods are, based on, their running times or other issues. Wrestling is going to be a little bit further down the road, but some of those activities where it's high risk in general, you're going to want to define those pods where kids are training, even though that's an individual sport, where you may have some scoring as a team, but for the most part, people are competing individually. So those are a couple things to kind of think about from the perspective of contact tracing, with the groups that players are participating in.
A quick question on the pods.
Sure.
Recommending, I'm asking if there's a recommendation to do any changes over the weekend. That way you have that 2-day gap to observe for symptoms. And then if you do have to contact trace, you're only doing it from Monday to Saturday rather than a Friday to a Wednesday if they change pods on that Wednesday.
That's going to decrease the risk. And what I'm really trying to talk about here is just, what are the consequences of those actions? I'm a coach. I know at different times I would have to mix up players. Mm-hmm. And I'm going to, I can't necessarily run a program where, people are together, in a group of 6 or whatever that may be until we get to phase 2. I can't do that and keep those people together and effectively train, a team. I'm going to have some mixing of those groups.
Sure.
But to the extent that you can minimize that and the extent you can track it, that's going to be really beneficial in terms of minimizing risk. But, looking at it from the point of view that weekend in terms of clearing things is a good idea because, that 2-day period is going to really minimize the risk, that you're going to be involving 2 or 3 different pods, when you have to contact trace.
Perfect, thanks.
Yep, good point.
Mark, there's a couple of questions
Oh, sure.
related to running if you want me to read them
Yeah,
out.
let's
Are you
bring
ready for
those up
them?
now. Yeah.
Okay, so would people in a group run be considered for exposed if wearing mask while running?
Yes, they would still, the mask use with athletics is not going to necessarily, give you a pass from quarantine. It doesn't give us that in other settings. And with athletics, especially with if you're running in a group, cross country, if you're running in an urban setting, you're going to be stopping at lights. You're in other areas, and you're typically running in a fairly tight pack with that. So I would, in that setting, I would look at anyone in the group as potentially being exposed. Good
And then
question.
a follow-up on that, it's sort of the same question. Would the wearing of mask by everyone mitigate who gets quarantined?
Are we talking about in a running situation or
In a
cross-country?
running, yeah, in a running situation or cross-country pod or group.
That makes it really challenging because of those issues, where you can't control that like you can in a cross-country meet, where you kind of delay starts and things like that, and you can kind of create that separation on the course where you're not going to be affecting other people. In this situation, I don't think that that's really something that's reasonable to do. You can look at doing smaller groups of pods and then, working with your coaches to kind of delay starts so that you're minimizing the impact. That's how I would approach it from a coaching perspective. And it doesn't have to be, where you're stretching out practices for another hour and a half. It could be that you're just saying you're grouping your runners by times, and you're saying, okay, let's put 5 minutes between this group of 6 and this group of 6, or whatever group size that you want to do. And that should be enough that, you're not running in a large pack, you're running in several smaller packs and minimizing that risk that's going to happen if one person becomes infectious, that you're not affecting, the whole cross-country team, you're just affecting a small group. That would be my advice in terms of how to handle that.
Okay, and there's one more question, but I think I'll wait to ask you because it's more about transportation. So
Okay.
I'll ask you when we get to that a little bit further.
Okay, that sounds good. So, the other thing that from a contact tracing perspective that we want to look at if we do have a case on a team is we got to look at, who's crossing that team or pod boundary. We know that happens. It happens all the time with athletics. You have, a JV coach who helps out with varsity when they're done with, their practice. You have officials, with refereeing, who referee multiple matches or games. You have, younger players helping out with officiating or tear down or set up, with other teams. You might have position practices. You may have players who are swinging up to play up on an older or more experienced team, to gain experience. You may have players backfilling teams if a number of kids are quarantined. So even though we have these team delineations or pod delineations, if we're doing that contact tracing, we really have to ask the question, well, who else could have had an exposure, with this group, during that period of time, because that may change from week to week based on all the issues that we have with COVID right now. The other thing is that we really need to kind of pay attention to which of our kids who are participating in club or extracurricular work around their sport or even a different sport. Right now, because of the nature of what's happening with the WIA seasons being so short, you're seeing soccer, volleyball, basketball is happening in Idaho. Teams are practicing in Idaho and using other options. And so I think you just have to be conscious that, you know, your athletes may have exposure to other athletes in your program through club, even though they're not on the same team. So when we're, you know, doing contact tracing, we really need to look at anything that they're doing outside of their school program, you know, for sports or athletics. And, you know, I mean, we all know that athletes are going to be hesitant to bring something up that's going to impact, you know, their playing time or, you know, their role on the team. I mean, this has always been the case. You know, players will play through with an injury, an ankle sprain, or other things that are going on with them. And so I think from the perspective of coaches, coaches need to really, you know, try to make it easier for players to report issues that they're having or exposures that they're having, because it's a lot easier to deal with this if, you know, a player feels comfortable to say, hey, I can't be at practice, or I'm going to miss this game because, you know, my parent is getting tested. I have a friend who was positive and I need to get tested or screened. If you can make that an easy process where players are not going to feel penalized to do that, it's going to go a long way to protecting your team. I've been coaching throughout this whole process, you know, with whatever outdoors, indoors, you know, with volleyball. And, you know, half a dozen times I've had to, you know, players, you know, tell me that they couldn't be at practice because of a potential exposure or something like that. And, you know, I've really appreciated that because, you know, that's, you know, while they're figuring that out, then I'm minimizing the exposure risk by not having them there rather than waiting until, you know, you have that positive result. You want them to be able to communicate with you when the risk is first identified, you know, if at all possible. So just have to throw in a volleyball slide. Notice these players all have gaiters on that are not really being used well. The other thing, you know, especially as we're looking at benches, you know, with matches or games, you know, there's a tendency to go, okay, if I mark off the bench, you know, and I have that 6 foot of separation or whatever I need for that, that's going to be something that's really well maintained. I think we really have to do a good job in terms of making sure that players are, you know, kind of, you know, abiding by, you know, kind of the spirit and the intention of keeping that separation. It's really hard with athletics, you know, and I get it. So just put this slide in there just to show a little bit of that. So the other thing, as we're doing contact tracing, I really want us to consider kind of what I call the extracurricular activities. And this is, you know, what happens as part of the team or part of that player's sport, but that doesn't necessarily happen in the gym, you know, and some of that has to do, you know, with, you know, issues of club sports or club practices that are happening at the same time as their school practices and games. There may be formal and informal team building activities that we really want to ask about. Oftentimes, you know, because of how small, you know, the sport world is for whatever sport we have here in Spokane, people have a lot of friends and relationships with people in other programs. And so, you know, if something is happening, you know, with blank schools, you know, football program, and you have you're a football coach, I would, you know, really ask, you know, does anyone have any connections, any activities where they would have, you know, had time with friends, you know, who are on that football team. You really want to be proactive in this because that's going to protect your program. We have such a short season for all these sports, you know, this spring, that, you know, if a team is out for 10 days and athletes are out for 20, because of quarantine or being sick with COVID, then that's going to be a huge impact. Where if you can just be a little bit proactive about that, you can minimize that risk pretty significantly. So, and this is for our COVID teams. I think it's going to really help to have good communication with your athletic directors and coaches before any problems come around. It's going to be really useful to meet if you're doing COVID work within different larger school districts where you have multiple buildings. Then may be useful to meet by sport, because then you can have a sense of what processes are in place, what their issues are, how they're reducing risk, and you can have those conversations early on before you start seeing cases. And we are starting to see cases this week in athletics. It doesn't take long for that to happen. So do have those conversations early. Ask about their safety plans and what they are doing in terms of cohorting or pods, or what documentation that they have that's going to help you in terms of identifying risk. Provide a kind of a good, clear set of expectations. I think a lot of coaches are not kind of steeped in this world, where they're doing the contact tracing. Some coaches are not full-time staff who are in building normally. And so, bringing people up to speed in terms of what's going to be the impact, of COVID, in a player or in a staff person is going to be really helpful for them. And then, I would encourage you to kind of, do some informal audits, walk through practices or games as those start to move forward. You can see some things from your perspective that are going to be really helpful, to bring up to coaches and athletic directors to improve their process, so that would be something that I would really strongly encourage, because, when we're in the gray zone, and there's going to be a lot of gray zones here, the burden of evidence on that, considering that a limited exposure or a more significant exposure in terms of the impact of number of kids quarantined is really going to be based on what you're seeing, what that program has a track record of doing in terms of compliance with everything that's going to be there to protect their athletes and staff, and the kind of the documentation that's there to support that. So, for example, if there's a situation like and we've dealt with this with the colleges, if they have a situation where they don't document who's on a bus in terms of where they're sitting, or some of those issues, or with longer meetings, and you can't establish who was exposed. Well, in that situation, the default is that everyone is a close contact, and that's really hard to hear. But if people aren't documenting that, this is a fairly efficient way for transmitting COVID. When we look at the little outbreaks and clusters in schools, right now, where we're seeing 2 or 3 cases, who are linked together, it's not uncommon with college athletics where we've seen, 4 or 5 or more than that, where transmission is occurring. And this is transmission occurring in a setting where you're super well supported with testing, where everyone is getting tested 3 times a week, where they have N95 masks, when they're, traveling, when there's a lot of support, on every aspect outside of the actual practice or the game. And that's where we see the risk. And that's why we want to make sure that we do everything we can to move this forward in as safe a manner as possible. So here are some examples of just some supporting documents that are really helpful from the perspective of contact tracing. If you're doing weights or anything like that, having sign-in sheets with times, not just with a date, that's really helpful in terms of limiting, the risk, or who's going to be quarantined or who's a potential close contact. If you have rosters for pod assignments if you're doing small pod or small group work, for each practice, so that who's been in what pod, especially for programs where you're having to, rotate people between pods in different days of the week. That's going to be really useful. Sometimes practice plans are really useful for delineating risk on that. So, this was really helpful in some situations where, if looking at some of our outdoor sports where the practice plan kind of delineated, exactly who was partnered up with who and what kind of drills, and you could really see, if there was close contact exposure, or if you're dealing with, something that was just a conditioning practice, and most of the distancing was, 15 feet plus. So having a good practice plan can help minimize the number of people who are unnecessarily quarantined. Your practice and competition schedules are going to be really useful because that'll help out contact tracers. Bus seating assignment logs. When we look at exposures, with transportation, we're looking 1 row back and 2 rows forward and side to side on the bus. So having a good idea of who's sitting where is going to be really helpful for documenting an exposure there. Lineups can be really useful, especially if you have an exposure to someone who's infectious, who's on the other team or opponent's team. That will allow us to figure out, if there was any exposure. And I don't know that it's practical in the high school setting, but in many cases, at least on the indoor side, many games are videotaped just from the perspective of feedback or parents who are doing that, or from a coaching perspective. And so that video can also be very useful for contact tracing. I know we've done that a lot with collegiate basketball, and that's been really helpful for that. So I want to talk really briefly about testing. It's not something that we have an option for now, but it is something that we are working with the school districts to have some testing that may be available in building. And this may be antigen testing for surveillance purposes, but there may come a time, when later on this spring, where this is a little bit more commonplace. Oftentimes, though, testing is looked at as a kind of a savior for athletics, in the sense that it can allow it to move forward. It really just identifies, when exposures occur. It has, some ability to prevent exposures, but it's limited. By the time you test someone who's and you find out they're positive, then you've probably already had 3 days, where they were infectious within the practice environment. So you're making sure that that's maybe not 6 or 7 days, but you're still having those exposures occur. So that may be something that's going to be beneficial for us, but it's not going to allow us to participate in sports without a mask, or some of those other issues where we've had questions about that. We won't be able to get a person out of quarantine, but it does have some utility. I always, if we have athletes who are in quarantine, or I always want to encourage them to get tested. And this is for several reasons. So if someone already has let's say they have symptoms, they have a cough, and because, they were in a pod, let's say I'm looking at my cross country runners, we have one case on a team, we have another student who has a cough, and, they're in different pods. If that one runner who has a cough gets tested and they're negative, that releases a whole set of other athletes from quarantine so that they can return back to practice. So a negative test can do that. It can move people more efficiently through quarantine, because if someone's in a setting, where, they had an exposure, this is more in a household setting, where, a parent has COVID or a sibling has COVID and they don't, the other sibling is just waiting it out and they're not getting tested. Well, they could be in that quarantine process for 24 days, where if they get tested and they are indeed positive, then that could have them returning to practice earlier. So there's some benefits to that. For multi-sport athletes, if you have a documented infection, at least at the current time period right now, they would not be subject to quarantine as long as they didn't have symptoms, for at least 90 days. So it does minimize quarantine for later on in the season. So that's another reason to get tested. And I also say it kind of documents kind of the effectiveness of your safety plan. And as we're moving forward, if you've got a good safety plan, you've got good documentation that there's very little transmission occurring on your team, then that gives your contact tracers a little bit more comfort, with interpreting those gray areas where, it's a little bit unclear in terms of the relationships, if there's a close contact exposure or not. So I put this in there because I think right now the documentation is fairly clear that athletics participants, whether athletes, coaches, officials, everyone needs to be wearing a mask. But we are going to probably have at some point situations where someone has a mask exemption or something of that nature. I just want to make sure that we understand kind of what that's going to mean for our teams. Basically, we have two scenarios. If the person who's infectious has a mask exemption and they weren't wearing a mask, transmission is going to be pretty efficient in that sense because there's no source control over that person who's infectious. So in that situation, we would quarantine the team with just one case or quarantine the pod with just one case. If we have a case who is unmasked, but they're exposed to a team member who was wearing a mask, then we're just going to automatically assume that that unmasked athlete is a close contact because they would be a little bit more susceptible. And if they became positive, they would be much more likely to transmit to other people. So that would be kind of the impact that we would see with that. I hope we're not going to have a lot of issues with that, but I think we're already hearing from many school nurses that they're getting questions about mask waivers for athletics. And I can see where that's coming from. I mean, there's for your track athletes, your cross country athletes, there's going to be a perception that wearing a mask is probably going to impact their times to some extent. And so I think we're going to see some pressure on that. And then the last point, if someone has had a COVID infection in the last 90 days, they would be treated as if they're, they've got to pass from quarantine as long as they don't have symptoms. Just in line with the other guidance with people who have a recovered infection. So I just put this slide out just because, and this is why athletics is so hard. I tried talking to my kids in a mask and it's harder to be heard. Situation, everyone's wearing a mask here, but if your coach is, having a 30-minute talk, then look at how many of the athletes here are within 6 feet of another athlete. I mean, you're not having really any physical separation. And in a football team, that would be really hard to do unless you had a megaphone or audio equipment, that would help with projecting your voice to have that 6 feet of separation. So it's just hard, with athletics. It's doable, but it is very challenging. So transportation is going to be another issue that we need to look at when we're contact tracing athletes. I don't know how that's going to be when we get into meets or games. But I know when I was a coach in high school, sometimes kids would take the bus out to an event, and then you'd sign them out, and their parents would take them home, or the parent, So we really need to know and to be tracking, who's going on the bus and who's returning on the bus and or maybe returning, with the parent or another guardian. So that's another thing that we just need to make sure that we're asking about. Carpooling is just not really doable to make safe. I mean, you're not going to have that 6 feet of separation. You're in a very closed space. Windows open are maybe going to influence that, but as a rule of thumb, in general, if someone's carpooling with another family, and one person's infectious in the carpool, we're considering everyone else a close contact. It's just going to minimize the risk of transmission and someone else being infectious on the team. But we know carpooling is going to continue to happen, and we know we're going to have problems with busing large numbers of students to different meets, cross country or track or some of those other sports, football, where you have a large number of athletes. It's going to be really challenging. You're not going to be able to keep that 6 feet of separation on a bus. And so you're going to have to make compromises. And the compromise that we would really encourage you to do is, if you're having to go under that 6 feet of separation or to carpool, is to really encourage that only with people that they're already close contacts with, so that we're not creating an additional set of close contacts. These are people that if there was an exposure anyway, they would have already been exposed in another setting. So that's going to be really helpful in terms of minimizing the impact, with athletics. We've seen a little bit of this issue with the colleges, when there's you're playing an opponent, and then after the fact that you get notified that some of the players or staff with the opponent's team were positive and infectious during the game or match or meet. And so that's going to be a little bit of a challenge. It's a little bit easier in terms of the contact tracing in some respects, because it may not be your whole team that's affected by that. It may be a handful of players, or maybe not, any players, depending on that. This is going to be a situation where we really are going to need some good communication with athletic directors, with different schools, to be able to get, information that's going to be helpful for the contact tracing. Was the positive person, an athlete? Was that athlete actually starting or playing in the game or match? And if so, during what time or what period? All of those pieces of information are going to be able to narrow things down in terms of the exposure risk, to athletes of your team or your school. So, those are going to be a little bit challenging. If there's problems where you're not able to get that information from other schools, or there's a HIPAA concern on that, this is where we want to really bring in public health in that respect, because then we can get that information or work with our counterparts in other counties to try to get that information that's going to facilitate the contact tracing. Just putting something in with basketball there again. Really focusing on that close contact, that high intensity sports, even with masks, we're still going to see, some risk of transmission there. So we are already getting questions on kind of what happens with these different measures of immunity with our athletes and our coaching staff. I think it's really useful, with the medical paperwork that kids are submitting. Hopefully there's a question on there to ask if they've had a previous COVID infection, because again, if they have, they may have a pass from quarantine. If that's the case, that can provide some options, for your teams in terms of reducing that risk. Right now, that's a 90-day pass from quarantine as long as they don't have symptoms. There is talk that that might be extended a little bit longer. We haven't had that information yet from CDC. And then this is probably not going to be an issue till probably late spring if we see vaccination for student athletes, but certainly for staff, it's going to be, some potential for, coaches and other staff who are vaccinated. And we're still waiting for the Department of Health and CDC to provide definitive guidance on what tangible protections from quarantine would be provided by someone who's vaccinated. The state and the federal government are being a little bit cagey on this just because of the issue with these new variants, and they're wanting to get a little bit more information. But I would anticipate us getting some guidance in that over the next month or so. So I just want to kind of look at kind of the impact on the school, outside of athletics. We've been really fairly lucky because the actual classroom experience of students has been fairly structured. You've got separation, you've got low intensity sedentary activities, you're wearing masks. We've had some transmission, but it's been pretty reasonable. I think the challenge with athletics is that if we're appropriately aggressive in terms of minimizing risk, we've got good cooperation with our parents of our athletes and our athletes in terms of kind of putting the team or the program forward, if they have an exposure and making sure that that they're taking themselves out of a situation where they're putting their program at risk, then we're going to see small clusters, potentially of transmission. But athletics does have that option for larger cluster sizes, 5 or 7, athletes. Certainly not; those aren't super spreader events, but they, it's just a little bit more efficient. So we just want to keep that in mind. When we look at our universities, it's been fairly universal. Every football program, every basketball program, tennis, soccer, everything has had cases associated with it or potential transmission associated with it. So we are going to see this with athletics. And so I really do encourage you to look at it as, not an issue of can we prevent this, is, how do we minimize the impact when this does come into our program. We've already started seeing this, with high school sports already in Spokane this week, and athletics has only kind of been in play for the last week or week and a half. So cases in athletics do cross cohort boundaries in school. So if you have an A-B schedule, they are going to affect both potential cohorts because of the nature of sports. We are going to see schools kind of move into a level 2 phase of quarantine or a level 3 of school closure at some point, in Spokane because of athletics. If we look at the criteria for closing a school, with kind of a high school or middle school cohort, at 6 cases in a 2-week period of time, in addition to 15% of classrooms. And so that's not that hard to do, especially if you're seeing transmission in other areas of the school. So we just want to make sure that we're moving forward with sports, but we want to make sure that we're minimizing that impact on the rest of the school as well. So I just had a few quick rules of thumb, just to review some of those. Again, these are not prescriptive, but these are just good rules of thumb that give us, a good way of looking at things, from 80% of the situations. And that's, kind of that 6 feet and 15 minutes is not going to be adequate for athletics. And we want to kind of think, 12 feet and under 15 for identifying exposures. We want to kind of err on the side of more potential exposure risk, when we are seeing kind of vague descriptions, in terms of practices and other problems in terms of getting information, about, potential exposures. Carpooling is always going to be an issue, and just this is a way to be just very prescriptive in terms of identifying those people as close contacts. And then, I do say erring on the side of being more aggressive is going to protect teams and programs, because, if we can keep a team moving forward, and, you're not quarantining the whole team, then the short season becomes a little bit more doable. We can move athletes around, we have other options. But, if we get to the point where we have a number of cases, then, then it's going to be really challenging, because you're going to have 2 weeks of practice, you're out for 10 days or 14 days, then you're coming back in, and it's going to be really challenging to have anything substantial out of this season. When I say err on the side of quarantine first and releasing athletes once you have more information, this I think is important. It takes a little while to contact everyone, to talk with families, to talk with coaches. I was just dealing with a situation this morning with a club soccer program where they had a couple of cases, and we just quarantined, the whole team until we could get more information from the parents of the two kids. And we could get their test results. Unfortunately, both test results came back positive. So in that situation, we continued the quarantine. But if those came back negative, then we would have released those two kids back to practice, and the team would have went back to practice. But that quarantine first is going to minimize risk of exposure to other athletes, and then keep that quarantine while you're gathering information. And then if you can release athletes, then that's going to be effective, in terms of minimizing the risk of additional athletes. So I want to open it up for some questions. I have a few other question prompts if I don't get anything that's covering a few areas, but what questions or what things do you guys want to discuss around contact tracing with athletics?
So Mark, I have a couple questions in the chat.
Okay.
So for cross-country team travels, or once a cross-country team travels on a bus with multiple pods on one bus, does that mean the whole team would have to quarantine if the pod had an exposure?
So how I would try to handle the transportation of this, if we're using one bus, and let's say I have 3 pods, I would seat people, pod A all the way in the back of the bus, pod B middle of the bus, pod C towards the front of the bus. And that way, if you have an issue in pod A, maybe that, if that person's at the back of the bus, they're not even affecting anyone in pods B or C. But that I think is going to be the way that you're going to minimize that risk of transmission, and affecting more kids, than your original pod that the runners practice with. That'd probably be the best bet. If you could do anything where you would have, and this is where I get to, everyone in that pod is potentially already exposed just because they're practicing together. Let's say if they're already exposed, I would feel comfortable putting like a buffer between pod A, B, and C, so that there's one set of benches on the bus where there's no one there. If we can do that, I mean, ideally we want to keep that 6 feet of separation from everyone, but if we can't, and we know that's going to not work out, then we want to keep them separated by pod.
Okay, the next question is, do we automatically accept a mask medical exemption from a provider?
So this is an area where we're seeing some issues from the state. They're deferring this decision to local health officers in terms of how they want to handle mask exemptions, kind of in the same way that they did this, in the beginning of fall. So the issues here haven't really been defined. I would say we really want to discourage the use of an exemption, especially if that person doesn't normally have an exemption for participation in class. I think the athlete needs to make and their family, the provider, a good case of why that athlete now needs an exemption, for participation in sports. But that is going to be a medical decision, from that athlete's provider, and to some extent, we're still trying to figure out how strict we're going to be on that, with our health officer and how he's going to approach that. But we are going to see differences between counties, and there's going to be some challenges with that. And so I think we just need to plan on that policy being in place. We hope to get some guidance for our districts, hopefully in the next week, on that, in terms of how we're going to deal with those exemptions.
Okay, and then for gymnastics, a mask can really impact vision. Only one gymnast at a time on the equipment. Other gymnasts could be stationed 6 feet away. Is there any chance, for the sake of safety, that gymnast can be unmasked on a piece of equipment and then masked immediately after dismount?
That, if we're looking at the governor's guidance, and this is kind of where this comes down to, there's not a lot of leeway that we have in terms of the governor's guidance. It's not really guidance, it's very prescriptive. And there is a potential leeway for a medical mask exemption. That would have to be a case where we'd have to understand why that mask might interfere with vision or provide a safety hazard with that. Certainly in some sports, it's going to provide a safety hazard. With wrestling, I'm not sure how they're going to handle that. We've punted that question to the state in terms of how eventually they want to deal with wrestling, because that is going to be, potential choking or other hazard, with that sport. So I'm not familiar enough with gymnastics to see if that vision issue can be accommodated. I don't see why it can't be accommodated in some way and still have the person wear a mask, but I think we need a little bit more detail on that, and then we can forward that to the governor's office.
And then going to level 3 in school takes 15 or 20% of classes. And so Greta, I can tell you that this is between the cohort versus non-cohort guidance. And so generally, we've talked, and so at this moment for your schools, we are at the 20% level. And then Sandy, do you want to go ahead and speak about what you have there about the OSPI?
Sure. I just wanted to let everybody know that OSPI hosted an LNI webinar at the beginning of January. I think it was on the 12th, on a respiratory protection program. It's a 2-hour webinar, and it was filled up. There were 200 participants, so they're offering it again. I was just on the website, and there's only 82 people registered, so there's lots of room. And I know some people wanted to attend that and weren't able to. So just FYI, I got the link there to OSPI's catalog. So if anyone wants to sign up for that, it's definitely worthwhile. Lots of good information on fit testing, PPE use and reuse, and LNI consultations. Particularly the last half of it is really specific to COVID. So encourage anybody who hasn't seen it to sign up. But if you can't make it, I was told by one of the presenters that it will be recorded this time. This one actually may have a little bit more information than the first one because they incorporated some of the questions from the first one. So anyways, when that's posted, we'll have the link and we'll try to put a link to that on our website too. So just wanted to let everybody know that's happening next week. Thanks, Lisa.
Yep. And then
Dr.
Bruce.
Spring?
Yep, there you go.
I'm Bruce Hafferkamp, AD at Shadle Park, and the coordinator of cross country for the GSL. So this is specific, but it's at the same time you used earlier with your comment about the governor that it wasn't really a recommendation, but it was prescripted. The WIAA says recommended a start of a cross country race should be in waves of 10. Cross country, as many believe, is a pure sport. So a normal three-way meet would have 21 runners at a varsity level. I'm wondering your feeling about having a very wide starting line with 3 teams separated by, let's say, 20 feet from each of the 7, having 20-foot wide spaces for each team and having a staggered, tapered start. That would there be enough natural distancing over that first 50 to 100 meters that would be no different in a way than 10 runners being 2 groups of 5 or 21 runners being 2 groups of 5 and separate groups of 2 and 3 for the remaining of the course, so we can maintain the integrity. I can't see basketball playing 4-on-4 because it would be safer, or volleyball playing 3-on-3 at a varsity level, and I'm wondering what your thoughts are about that for cross country.
So, what I just want to really acknowledge with that, I mean, there are some things that we can tweak in terms of our sports to minimize that risk. But, in the same way, like you said, basketball is, you're only going to be able, limit the risk a little bit, with how practice is done and how some of these other things are done around the sport. But the sport is the sport, and you're not going to necessarily be able to modify that in ways. I think with cross country, your idea in terms, if I'm understanding this, of having staggered starts is going to go a long way towards reducing risk. The situation with this is going to be a little bit different than if we're looking at, with a cross country team and, they're running in a group in a pod, because the training runs and training as a team, you're having exposure, daily or multiple, days of a week, where in a situation like this, if we can have those staggered starts or other things that are put in place to provide some of that separation, then that's going to help a lot in terms of reducing risk and may not result in a quarantinable contact, if that makes sense.
Well, so a single 21 at the line versus 10 at each line being released with a timed start, a moving clock, basically, where you
Right.
send them out. And the GSLADs, we talked about, well, let's go with the 21 because it's really what the spirit of the sport is, and you diminish the spirit of the sport at the varsity level by having waves of 10, not a big wave of 21, but mitigated by having it a very wide tapered start. And I just wanted, I don't expect like, oh, that's the same thing, but would you view that as a wrong thing to do, if that's a strong word, versus just spreading them out 10 at a time and not really having a cross country meet?
I get that. I think, having some, different waves is going to be a little bit easier. My concern of spreading them out at the start is how long does it take until, they're together in a pack, with moving forward. That's my only concern about that. And that's probably a little bit dependent on the course, on that. If your course is a straightaway for a sufficient amount of time to ensure that there's some separation of the runners, that might be doable. But if your course is immediately going into turns and a lot of it's not a straight course where you're going to just encourage runners to start clumping together, then starting 21 people on a line together, even if spaced, if within a couple 100 yards they're going to be clumped together, then that may not be as effective as we'd like. I would lean a little bit more towards the groups of 10. I think that would be a little bit more effective from a safety perspective.
Thank you very much.
Yep. Any other questions, Lisa? Otherwise, I have a couple bonus questions.
Yep, there's one. All SPS masked exemptions must be reviewed by the health service director, Becky, at this time. So that's
Okay.
just an FYI.
Oh, and that's going to be really effective. I think, the thing that we don't want to have happen is that cross-country runners and track athletes and are going to consider that this is a way that they can improve their time by a couple of seconds if they don't have to wear a mask, and that we're going to see a rash of these exemptions. I think that's going to be really challenging in terms of dealing with that. If there's no other questions, I have a couple of just questions that came up after the fact that didn't warrant their own slide. So in general, kind of how many cases must there be to quarantine a team? It's, kind of a rule of thumb is 2 cases. And those 2 cases don't have to demonstrate transmission within the team. It would just be 2 cases who are infectious, within a practice environment. Is it justifiable to quarantine a team with just 1 case? Yes, and we've done that with the colleges at different times. If you have situations where you have an athlete who's not wearing a mask or who's a poor mask wearer, or you're having a situation like we had with a local college basketball team where they had a 45-minute meeting in a small locker room with everyone there while someone was infectious and no documentation of where people were sitting. We went with the quarantine of the whole team, with that, because we couldn't identify who was a close contact and who wasn't. What happens if the only infectious day of an exposure is on a day where a student athlete did not attend classes? So let's say, we have a basketball player and they play on Saturdays and they were infectious on that Saturday game, but they were not in school while they're infectious. We would not count that player towards, the cohort that they go to school with. If they're in the A cohort and they weren't infectious in the A cohort, but they were still infectious in their practice, it doesn't count towards that A cohort's numbers of cases from the perspective of moving between level 1, 2, and 3. So we're really trying to limit those issues where we're moving between levels for the building to, when they were infectious in the building. How would we take locker rooms into account with contact tracing? I mean, this is going to be the same issue. I know the different conferences are looking at kind of locker room guidance where you're limiting the number of people going in. You're kind of taping off areas where people can sit and change, and you may have a locker room monitor, to make sure that the people are coming in and out. If you're doing that, and you're ensuring the separation and people are just going in and out to change, it's not being used to shower, then that probably isn't going to impact contact tracing because we've got 6 feet of separation. They're wearing a mask while they're changing, and you're kind of at a sedentary, level of intensity, or you're not, doing anything where that 6 feet would not be sufficient. So locker rooms, if they're approached correctly, should not play a significant role in terms of contact tracing. What should I do if I can't get information about a case on an opposing team? Contact us at the health district and we can see if we can get that information that's going to facilitate the contact tracing. And I think we already talked a little bit about how athletic cases would be counted for the movement to level 2 or 3. They do count as long as they're infectious while they're in their particular building schedule for their cohort. So any last minute questions? I know we're running a little bit longer, but I just wanted to make sure that we're addressing all the questions or concerns, and we will look to try to get some more guidance on the mask waivers, and certainly if there's a situation like the gymnastics ones, email those to us, and we will try to get some information either from our health officer or from the governor's office to provide some feedback on those.
Bruce, did you have another question? Okay, I'm going to stop the recording. Mark, are you okay with that?
Sure.
Okay.